Hello and welcome. This is a demonstration of Skills 3, Administering Oxygen via Nasal Cannula without humidification. You have 6 minutes to demonstrate this skill. Let's begin with steps 1 through 5. Step 1. Obtain and review the physician's order. Step 2. Obtain the needed equipment. Step 3. Wash hands or use alcohol-based hand rub for hand hygiene. Step 4. This step requires a series of many steps. First, approach the patient bedside. Next, greet the patient using only your first name and identifying yourself as a future respiratory therapist. Lastly, identify the patient using 2 patient identifiers. Then on to step 5. Explain the procedure and obtain consent from the patient. Let's begin.
Verify my physician's orders. Hello, Mr. St. Clair. I'm Nathan, your respiratory therapist today. May I please use your full name and date of birth?
Yes.
First, patient identifier.
Thank you. All right, Mr. St. Clair, I'm just checking your armband just to confirm.
Second, patient identifier.
So today I'm going to be placing you on some oxygen by nasal cannula.
And then we would get consent from the patient. Now the student is going to connect the tubing from the oxygen supply to the tubing on the cannula. Notice how the student is careful not to let the part of the equipment that goes in the patient's nose touch any surfaces. Now he has cut the oxygen supply on and regulated the gauge to the correct liter flow. Now he is checking to ensure that oxygen is flowing before he applies the nasal cannula. When placing the cannula, make sure that the prongs of the nasal cannula are facing down and that you will loop the tubing around each ear. Then adjust the straps at the neck so that the tips remain in position. Then instruct the patient to take a couple deep breaths through the nose.
All right, Mrs. St. Clair, can you take some deep breaths through your nose for me?
Yes.
So all your vital signs look good. Is there anything else I can do for you?
No. Thank you.
No problem.
At this point, the student will check the surrounding area to make sure all safety precautions are observed. There's no sparks or flames. Then, the student will remove gloves, wash hands, or use alcohol-based hand rub for hand hygiene. Most importantly, the student will then document in the patient's chart. We're going to be careful to make sure that appropriate verbal and nonverbal communication with the patient and personnel is used. Please note that standard precautions are used throughout this skill. Now that you've seen the demonstration of the administration of oxygen via nasal cannula without humidification, now we will demonstrate the administration of oxygen via nasal cannula using humidification. If you look in this picture, you can see a humidification bottle sitting over here to the left. So to begin, we will repeat steps 1 through 5. And then, instead of directly connecting the tubing to the oxygen wall source, we're going to add this humidity bottle. Let's begin. Notice that in order to attach the humidity bottle, you need to remove the green Christmas tree adapter in order to properly place the humidifier. If you do not have a humidity bottle as pictured here, then you may verbalize that you are placing a humidifier and it's properly attached to the flow meter. Then you will turn on the oxygen using the gauge, and then you will attach the nasal cannula to the port at the front of the humidity bottle. Make sure that it's nice and firm connected. You will also again check to make sure that there's air or oxygen moving through the nasal cannula before placing it on your patient, and then continue to place the nasal cannula with prongs facing down, securing the tubing around the ears and tightening around the chin, and then instruct to take a deep breath as we did in the previous video.